Good evening, my dear friends. Myself, Dr. Joseph Casey. Today, I would like to clarify the doubt of a famous Vaidya. So, what he asked one question: what is the similarity between homeopathy and Ayurveda? See, in homeopathy, they speak regarding similar things will increase the similar things in our body. So Samanya Vishesha Siddhanta has it is been told in Ayurveda. Very clear. So Mamsasya Mamsa Vriddhi. From by taking Mamsa, the Mamsa particles in our body will increase. The same concept is being explained in homeopathy also. One. And second thing, in homeopathy it is being told that if a medicine, if you are giving in a larger dosage, it will create the same disease which you are having. It means that if you give in a small dose, it is having a capacity to cure it or heal it or decrease it. And now coming to Ayurveda science. Let me ask you, my dear friends, how many of you have treated asthma, psoriasis, or rheumatoid arthritis pain with whichever the medicine you are giving? How the patient do not tell you how increased the pain after taking your medicine? Does not your patient told that after taking your Dashamula Katutre Kashaya my asthma got increased, flames are coming out more? Did they complain that my itching skin is increased? I have experienced in my experience. So at that time I started to read homeopathy, and I understood one thing: the medicines which is going to increase the disease symptoms, it has the ability to decrease the disease also. Then I started to think in that way, and I asked the patient to reduce the dose from that off to off dose. So I started with the concept of microdosing, which I have explained in my previous video. Just you can go through that. See, microdosing is very much tuned type of medicine where it will not act in excess, it will not give side effect, because whenever you give a dose which is more than a minimum thing, it will act in a micro level or atomic level or nuclear level. See, if you give a medicine in a such a way that let medicine only act, means whenever the patient takes that medicine, that problem will be solved. Whenever we withdraw it, patient experience the same. So when you give a microdosing, what will happen? Even though we think that it is very slow, no. The atomic bomb is more powerful than any normal bomb. Why? Because each and every cell start breaking. Tuck, 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 tuck. It's more powerful. It acts as donor cell therapy. So, as you see, there is, if you see the Newton's law, for each and every action, there is equivalent and opposite reaction. If you give a medicine, some effect will be there and some side effect will be there. Okay, so how to minimize this side effect means by giving in a very slow dose, such that let these molecules will be a exemplary for the body. It should be a correcting factor of the body. It should reduce the deficiency of the body. By analyzing the nadi, if you give in this way, the patient will not suffer from much side effect. So when I have understood that by giving excess of dose, usually Ayurveda doctors give 15 ml of kashaya, where I give 2.5 ml and below itself. I will not go up to 15 ml. So all these I have created or I have developed based on my experience. When I understood that there is similarity between the thought of Ayurveda and homeopathy, I think why do not the Ayurvedic drugs could be converted into homeopathy. So I have read regarding homeopathy, and my friend, he used to conduct camp in my clinic, and he used to for a years And for a year we conducted free camps. We sit together, and he's actually an MD doctor, and sit together and plan and discuss. So I got many such ideas, and many similarities was working out. So this gave an immense idea of how this homeopathy worked, and I understood that it's either the same thing. So why alcohol? They have used only one alcohol to treat all the disease. It's avesam. In Ayurveda we have kashaya, kalka, swarasa, lehya, churna, basma, taila, and what and all, arka. See, many preparations are there, and still we lack to treat the patient. Why I tell you? Because how many of BAMS doctor, Ayurveda doctors are practicing pure Ayurveda? Why are nowadays generation of doctors, outcoming doctors, are not practicing Ayurveda? I have been taking class in many of the medical colleges where I get used to counseling them. What you would like to become? No, sir, I would like to practice in allopathy doctor somehow to do, but we know that Ayurveda cannot do much because their guru also did not teach them much. Because where is the lacuna? Will you able to tell me how many of the Karnataka doctors, all over the India doctors are practicing pure Ayurveda science? Let it, you can give n number of reasons. You are in rural area, you are in some area where you have to obviously practice your system like allopathy, drips and everything. That's a hooked up story. Fine, I agreed. But why not they practice Ayurveda at all? So if you go to few doctors, you will not be able to understand whether they are Ayurvedic doctor nor an allopathy doctor. Completely pure allopathy practice they are doing. So then actually if at all, if we had that many resources, that many technology, that many things, then why those people had problem of practicing Ayurveda? It is not being taught in a proper way. They did not understand the nadi. They did not understand the concept of microdosing. Many have started to treat in Ayurveda, and they found that all the symptoms are exaggerating. It's not reducing, it's increasing day by day. So they do not know how to decrease it. So henceforth, they tell goodbye to Ayurveda and practice allopathy. So it's my sincere efforts to tell my Ayurvedic fellow members, you have got immense plant knowledge. You give your little bit of brain and application to it, understand all the pathis, just like Kuempu has told. Whatever it is in all the dharma, good things you take and catch and receive. Negative things you leave it out. The same way, understand all the pathis. Why do you tell I'm an Ayurvedic doctor? I only give Ayurvedic medicines. I will not learn any other system of medicine. What is the use? Patient will not ask you which system of medicine you are, but whether I am able to heal them. So I have learned hypnotization, marmam, acupuncture, drone, osteopathy. So many such things. So I have dedicated many classes of Nadi Chikitsa in different platforms. Okay, you can see in my YouTube channel also. And many of the allopathy doctors, physician, pathologist, cancer specialist, skin specialist, very renowned personalities had come to me, learnt Nadi, and they are practicing beautifully. Then what else I need? So they are all doing good. They are taking medicines from me. Allopathy doctors are practicing Ayurveda. The pity is that Ayurvedic doctors are telling Ayurveda is not working. What a pity on it. So I ask you, just learn the things. Do not compel your mind to think in a very narrow mind. Open up your mind. Liberate yourself. At least put a thought process inside you. Keep on analyzing what is not working within your treatment. If you do it each and every day, you will be a scientist, researcher, and your contribution will be appreciated. Not initially, maybe, but definitely one or the other day. Thank you very much. Have a good day.